Welcome everyone to MuniMeterHealth. This is Dr. Jaitly. This is your um, source of information for learning cardiology, and of course a source to enhance patient education, medical education together to improve the clinical outcomes. So welcome again to I'm so happy that you're associated with MuniMeterHealth. Thank you again for again advancing my belief, which is now turning global, to improve the human heart awareness with both in health as well as in illness. Today we're going to be talking about what is pulmonary arterial pressure and how do you measure it by echo. Okay, because pretty much all echo reports should contain the pulmonary arterial pressure. Now we know pulmonary arterial pressure should be less than about 20 millimeters. Okay, that should be a normal. If it is more than 20, then you begin to wonder that the patient is starting to develop mild pulmonary hypertension, etc. So pulmonary arterial pressure is very, very important. Now, how do you measure it? You measure it in two views. So first view that in the echo you'll do is your apical view, and this is your favorite apical view where the heart is inversely represented, if you will. And so this is your tricuspid valve. This is your mitral valve. So at the tricuspid valve, you will have all sorts of regurgitational jets here, if you will. And these regurgitation jets will look like this, more or less. Let's quickly do that. So that becomes your TR. So the TR velocity is measured first, and that'll be your jet. Now the TR velocity will look like something like this. And so it's measured in meters per second. Okay. And say the velocity is about 3 meters. I'm just giving you an example. So in my example, say it is 3 meters. That means the pressure gradient across the RV, this being your RV and this being your RA, through this orifice. So that's based on the Bernoulli equation. So when you apply the Bernoulli equation, the pressure gradient is 4V square. So that means 3 meters per second should be computed here. And that becomes 36. Okay? 3 3 is 9, 4 36. So 36 millimeters is your pressure gradient, obviously from RV to RA. But what is pulmonary arterial pressure? Pulmonary arterial pressure is this velocity, that is 4V squared between RV and RA, and that is 36 millimeters. We have taken this example, plus the RA pressures. Remember, the RA pressures will have to be measured. And how do you measure the RA pressure? So this is one view that you did, apical view, to calculate the tricuspid regurgitation jet. The second you will do is the subcostal view, and that subcostal view you'll measure the IVC. So the IVC is measured, and that is mainly to measure and find out what's going on there. So IVC, if it is less than 17 millimeters, that means it's normal. Normal dimensions are less than 17 millimeters. So if it is normal, then the RA pressure is 5. Okay, so this is your RA pressure will be 5. Now, if the IVC is more than 17 millimeters and the IVC is more than 50% compressible, that means if you were to do the respiratory variation here, and so if it's more than 50%, this is like the sniff test, I call it sniff test. So have the patient quickly sniff, then you compute 10 millimeters to the RA. Okay. If IVC is again more than 17 and it is less than 50% compressible during the sniff test, then add 15 millimeters to the RA here in the equation. And then, of course, if it is more than 17 and there is no change, that means it does not, from the sniff, there is no change in the IVC and it's dilated, obviously 17 is dilated, and no change here, then you compute 20 as your RA pressures. So RA pressures can be 10, 15, 20, depending upon what you see in the IVC and what you see in the compressibility. So IVC measurements have to be done. So measure that, and then you have to do the sniff test. So two things, very simple. So tricuspid regurgitation should be measured in an apical view. That should be measured in the velocities, meters per second. Compute that into the Bernoulli equation. You get the pressure gradient across the RV and RA, which is the tricuspid valve, and that is, say, 36 millimeters in our example. Combine that and use that to add to right atrial pressure. Right atrial pressure is measured in this fashion, 5, 10, 15, or 20, depending upon what the IVC dimensions are. If the IVC dimensions are less than 17, just add 5 only. But if the IVC dimensions are more than 17 millimeters, then look for compressibility of the IVC. If it's more than 15%, then it's 10. If it's less than 50%, add 15. And if there's no change, then add 20. Okay, so simple. Pulmonary arterial pressure is so important and should be part of all your echocardiography reports. And of course, I'm sure there'll be a question one way or the other on the echo boards or maybe on the cardiovascular boards for all my fellows. And being a teacher all my life, I know exactly what they're going to be asking, at least one question directly or indirectly. But do not do not use this as a substitute to your text. Please use this as a supplement to your text, please. That's my best advice. Okay, so please continue watching and associate more and more on MuniMeterHealth, your source of learning for cardiology and, of course, advancing human heart awareness. So thank you again. So long. This is Dr. Jaitly.